This is Dr. Richard Shore. I am the president of the Suffolk County Medical Society, and we have a very special and honored guest today. We have Dr. Charles Rothberg, past president of the Medical Society State of New York, and Dr. Badri Nath, the past president of the Suffolk County Medical Society. This is The topic of our discussion tonight is a very special program that Dr. Rothberg spearheaded and really brought to fruition after many years of efforts. Dr. Rothberg, we're going to go on Zoom here so you can see Charlie and me speaking. Charlie, are you on?
Well, how are you tonight, Richard? It's always good to catch up with you, and we do have some things that are interesting to talk about.
Yes, go ahead. I'm doing quite well.
I don't want to take all the credit for the program, although I think I did really help to get it going. We have an awful lot of medical experts, including Dr. Dowling from Suffolk County, who really drove a lot of the scientific basis for the program. I just want to make sure that people understand it's like anything else that's worthwhile, it's a shared effort.
So can I show, I want to show something here regarding an important screenshot. If anyone's looking here, so basically, what I'm showing now, Charlie, is a headline from the New York Times. It was top ER doctor who treated virus patients dies by suicide. And I think that was a shot across the bow for many people who were not in medicine to realize the extent, the psychological trauma for the responders to the COVID disaster that we all faced. So, with that, why don't you start?
Sure. I guess the best place to begin is that the psychological stress that's associated with pandemic and even with the practice of medicine is something that's well studied, and it is a high stress profession, and there's a lot of demands of the job and cultural characteristics that are associated with physicians in terms of our strength and our self-denial and other characteristics that are virtues in becoming and being a physician and helping others, that doesn't necessarily allow us to sort of get out of our own way if the stress factors and quotients are excessive. And this particular doctor, I think, really blindsided her family and her colleagues in that nobody suspected that she was at risk for that kind of activity. And I only know about her suicide from the press reports, and I don't believe that a whole lot is known about if she had any predisposing factors. I know that she was a COVID survivor herself, and that she had returned to work, and she was a director of an emergency department in a very busy health system in New York City. And it makes you think, if it can happen to somebody like that, it can probably happen to any of us. And I can only imagine how desperate somebody must feel to take their own life in that way.
I think that a lot of physicians right now are feeling desperate, whether they're on the front line of COVID treatment or they are fighting for their economic survival, their practice's survival. What is the peer-to-peer program?
Well, I'm glad you asked. We've been working on this for quite some time, but we finally have the imperative to get it moving. Essentially, about 4 or 5 years ago, MISNY's House of Delegates, that's the Democratic governing body of our state medical society, made a policy to have a task force on physician burnout, which was really on the rise at the time. And that was extremely well run, a fellow by the name of Mike Privatera, who's a psychiatrist from Western New York and a real thought leader in this space of physician burnout, was its chair. And they broke out into several work groups, some of which formed a scientific basis for what this program is going to become. One of the activities they did back around 2016 was they surveyed MISNI membership, and we got 1,200 responses, which is a pretty unusual. Most of the time, when membership organizations survey their members, they get very, very low response rates, usually on the order of less than 17%. So we had a good response rate. It was believed to be statistically significant. And the data was analyzed in a collaboration that we have with the Federation of State Medical Boards. And what it showed was that it was system stressors and not individual weaknesses, if you will, of individual physicians that contributed to burnout. But it was the grind that has become so much a part of our day that either results in moral injury or is just not rewarding, the loss of autonomy. A lot of the things that folks might think about was really injuring our physicians and just resulting in a lack of self-worth, if you will. And while suicide certainly would be, a tragic and extreme example or manifestation of those stressors, they do have a toxic effect on productivity, enjoyment of life, enjoyment of work. And some of the things that we're seeing is that physicians are leaving the field early, or they're not as productive, or just, their work suffers. So there were, I think, 5 scientific papers that were written in conjunction with members of our task force and some of this data. And that is on MISNI's website if folks would care to read that. One of the work groups was to develop a peer-to-peer program. And it's modeled after similar programs in law enforcement, in the military, and even the Bar Association, where I guess the program fills a void that we have at the Medical Society. We have a committee on physicians' health that assists people whose health affects their practice. And it's a place that people can go and consult and enter a program that kind of gets them back on a path where they can return to work. But this program is different because it intervenes before it's actually affecting your work. So if you're just feeling some of the effects of stressors like the pandemic, sometimes all you need is to talk to a colleague and sort of get help in just a conversation or the camaraderie, to be made calm, to be made feeling that you're efficacious, that you're important, that you're not unusual in feeling what you're feeling. And sometimes just that interaction is all you need to get back on the path of strength. Of course, some people, might need other resources, and the peers are prepared to make those referrals. Say somebody is having, struggling with substance use, that might require a different kind of intervention, but that's not what we're about. We're voluntary, so a person would volunteer to be in this encounter. It's trusted. It's not related to your employer. It's basically either going to a coffee shop for coffee with a colleague, or in this day and age, it'll be a virtual coffee shop because the coffee shops are closed. And you don't have to identify yourself more than enough to make a contact if you choose not to. If you're in a geographic area that's very isolated, or specialty where it's very small, and you think that you might be well known within that specialty because it's so small, we can refer you to
Hey, how are you?
Good evening, Dr. Nath. I was just answering a question that Dr. Shore had given us. So I was telling folks a little bit about the peer program that we're going to be rolling out in the next few weeks.
Hey, Charlie, how are you?
So we have just joining the call is Dr. Badri Nath, who, for those of us who this was a video consult for telemedicine, I can say is ambulating well, but is
I'm just going to find a place I can sit.
He's oriented to place. Time, he's a little bit late for the call, so I'm not sure about that one. Okay, so why don't we? So
he's a good fellow. We had a little fun with him on the medical staff meeting where he asks questions all the time, and so folks were having a little fun with him. That does Dr. Nath have a question? Recognizing him before he even raised his hand.
So Badri, we were just talking about the MISNI peer-to-peer group that just started, and so we were talking about why a physician would feel the need to access this. My question for you, Charlie or Badri, whoever wants to take this, is in the past, there were some fears amongst physicians uh, who concerns about accessing a system such as this. Would you guys care to talk about some of those and if they have been fixed or remedied?
Well, let me, and I'd like Badri to speak. Badri, I know you didn't introduce him at the same time that we introduced each other, but Dr. Nath is not only has he been the president of the County Medical Society, but he's also been president of more than one medical staff. So he has, I think, a great deal of experience with issues that affect physicians and the operation of of a robust medical staff. And I'm glad that he joined us because I think we can tap into that body of experience. But I think what you're alluding to is that in the workplace, if folks are feeling the effects of stress, since we know that system stresses are the principal culprits, sometimes it's related to the place of employment. It could be interpersonal relationships. It could be a relationship with your boss if you're employed. It could be a relationship with one of the other disciplines at the hospital, maybe your section chief. You might not want to seek this kind of assistance from a program that's sponsored by your employer because you really don't want to necessarily reveal a vulnerability that might affect your employment. And our program is superior to that because it's run by our professional association. It's not run by your employer. There's no reporting. The data that identifies will be de-identified shortly after the encounter. It's a place that people can trust and feel safe. And I wanted Dr. Nath to speak a little bit about that because he was on several conference calls that I was on where we were supposed to be talking about COVID, and fully half of the questions from physicians related to mental health, which was striking. Dr. Nath?
I'm not sure if Dr. Nath, are you hearing us?
Is it the Charlie's video or?
I sort of introduced you because of your expertise as a medical staff leader and how some of the recent conference calls that we've had talking about COVID with our medical staff, fully half of the questions from physicians were relating to mental health. Your dog is very cute, Richie.
one of my dogs. So I'm not sure if do you hear us, Badri?
I just lost the bit of the Charlie's last piece of the conversation. I think you're right. I think a lot of people are stressed about multiple things. I think one of the things is you're going to start seeing is not only the emotional stress, the financial stress, because you can see that only two specialties were okay in the last 2 months. One is pulmonary, one is critical care, and internal medicine. Internal medicine is mostly hospitalist. And so the revenue cycle of those three specialties did not affect. And I can see ongoing. And I'm chairing the for St. Catherine the reopening committee for when to restart the surgeries, and when we restart the surgeries, how we're going to restart. So when I talk to other surgical specialties and subspecialties, everybody feels the strain. And I think the March and April, they're okay to survive because of the receivable is there. But they don't know going further how many of their patients are going to come back to surgery. And that puts a stress, emotional stress, and the psychological stress, and a monetary stress on the physicians and their staff. And it's going to be a snowballing effect. And one of the concerns I've seen is that everybody expressing the same thing: how soon the patients are going to come back, and then what happens if the second surge occurs.
So if um, so if if a physician is feeling extraordinary stress, uh, how would the physician access the peer-to-peer program, whether it's economic stress or stress from being around the horrors of severely ill COVID patients, the volume that we all have to deal with while in the hospital. So Charlie or Padre, how would somebody access the peer-to-peer system?
I think Charlie did mention that there are going to be physician volunteers for each hospital, and I think Charlie wants us to give the names, and I think we need to identify a few physicians who are emotionally strong can help and identify. I think that's a very good program. I think you need to identify a bunch of physicians who are themselves very strong emotionally that they can support the system and their peers. And I think the brief for 4 hour course or 5 hour course that Dr. Katz is going to put forward, I think will also help you to guide through. And at a point will come to you reach a point where you may say, hey, this person needs a little bit more help than just talking to somebody. I think we'll be able to direct them in the right direction.
Do you need to be a mental health expert or a psychiatrist? Can a urologist volunteer to be a peer-to-peer helper?
Did you have a special one in mind? A particular one? So yes, so Dr. Nass pointed out that there will be training. I just wanted to be a little more specific about that, so people don't think we're giving them homework. If you want to be a volunteer for the peer program, so you would be a peer counselor. I'm trying to throw out some words there because we're not treating people. We're not treating our colleagues. We're just being a peer. So I would define the person who is seeking peer support as a peer client. And I would call the person who is trained to be the peer, the listener, to be the peer counselor. And we're planning to train people to be counselors so that they learn the kinds of things to listen for, how to express their empathy. I think being empathic is probably the most important criteria that a person can possess to be an effective peer. And we're going to provide training, at least initially, that will be about 4.5 hours. But it's not going to be 4.5 contiguous hours. You don't have to take a half a day off of work. There'll be a 2-hour program that will be with somebody who's I don't want to give the name because I didn't sign the contract yet. But I'm meeting with her tomorrow to do that. And she happens to be a nose and throat specialist who ventured off and started this program at a very prestigious place in New England, and now is on her own. And she's going to train people through a hands-on. It's going to be over Zoom because of the, everybody has to have the social distancing. A hands-on 2-hour program on peer support. I've taken her 2-hour program. I thought it was extremely worthwhile. I'm not suggesting people should take the program and not become peers, but I think it's just gives you a lot to think about in terms of how we approach one another. And I think that most physicians are intellectually curious enough that they would enjoy that. Then Dr. Katz's program on psychological first aid, which Dr. Nath, I think, got a little taste of, and I think it sparked his interest. Tell me if I'm correct, Dr. Nath. He's going to give an hour talk on psychological first aid, which will give people the ability to think about and to summon up their own resources on being calming and making people feel validated and important. And then there'll be another hour, which already is on the MISNY website, that anybody can take that's a member for free of charge on mental health and disaster. And again, Dr. Nath, I think, saw part of that program in the abbreviated slide set. And I think you would agree that it was compelling, wouldn't you say, Patrick?
Yes, I think he gave a very brief and exhaustive overview what to foresee in the coming months.
We give everybody like the tasting session. If you're going to today, we had a tasting session. If you're going to plan a party at the catering hall, we give you a little taste. So then there'll be a half an hour just on the operational aspects of the program, and then you're a peer. And this is suitable for people who are students. It's suitable for people who are residents. This is suitable for people who are practicing physicians, even retired physicians, because essentially it's about a human-human interaction. You don't have to be a mental health specialist. In fact, it's probably preferred that you're not a mental health specialist, because you'll be relating on a very visceral level with the peers. And before we leave today, I just did want to talk about the role of mental health in our program, but it's separate.
So I just have one question, and then maybe it's not live yet, but how would a physician who needs the peer-to-peer access the program?
Okay, we've established a phone number, and it's not It's not live yet. It's not manned by an operator, but I believe on Friday it will begin to be accepting calls, and we'll publicize that number. And a person would, call up and say, "I'm Dr. So and so, and I'd like to speak to somebody with the hotline." And then the operator will have a script to make sure that you don't have an emergency. Say, do you feel like you want to harm yourself? That would then immediately be referred to somebody who can help with that. And if you're not somebody who needs immediate help, then you will be contacted by a peer.
Okay. And is this one big concern was is this discoverable by OPMC or the other regulatory bodies?
Okay, that's a tough question. The answer is no.
Good.
And this is my opinion, not a legal opinion. And the reason is that it's well, we're talking. There's going to be another component before the peer-to-peer is running. There will be a hotline that will be manned by psychiatrists, and that will not be discoverable because evaluation by a psychiatrist is considered privileged and is not discoverable. That's separate from what we're talking about. That's a stopgap until the peers are trained and up and running. This is just a conversation that you're having with a colleague, like the one you and I are having tonight. So it's not discoverable any more than any other conversation. It's not like a treatment episode.
Right.
In other words, if you're treating somebody in your urology office, an attorney can ask for your records in a liability matter, and usually you provide them with the proper HIPAA consents and all that, because if you don't provide them, you can be subpoenaed. But this is not a medical intervention. This is a chat between two colleagues.
And there's no need to keep written records.
There won't be any records. The record that will be kept and will be explained to the client is going to be a 3x5 card, and it is going to be used just so that we can collect, I guess you call it metadata, so that we know how many people we've accessed in the program and the kinds of complaints that they come to talk about, and the kind of referral that we've made. But there'll be no personally identifying data. They will all be de-identified. And the purpose of the 3x5 card is just so that we can assess the value of our program.
So Badri or Charlie, how do we promote this incredible program amongst our physicians through the medical staff offices or through the Suffolk County Medical Society and the other county medical societies?
We can through the medical staff offices, we can send an email to all the physicians.
Okay.
Like I said, we can send email to all the physicians to the medical staff office from each hospital, and also we can put through our website, or we can do a mass email to all the members that this program is available. And because the reason is, in the social media, when you look at the Facebook and all these Instagrams and social media, people only put the positive side of their issues. They'll say, wow, look at this, so glamorous and everything, but nobody looks at their negatives. So the peer pressure that comes in because of social media here is the other way. We're trying to help through the media because people think, oh, yeah, I'm the only guy having this problem. So when they talk to their peers, they understand that they're not alone, and there are other people sharing their views, and probably this will be a good forum for everybody to connect.
Agreed. Well, anyway, I'd like to thank both of you guys for agreeing to speak in this forum. We're going to post this broadcast on the Suffolk County Medical Society website. I suggest that we also all share this on our own individual Twitter feeds and Facebook and any other way in which we can reach physicians, because you never really know where that person is hurting. And you certainly, as you alluded to, Badri, you certainly can't tell by the smiling pictures on Instagram what's behind the eyes. So, any other comments either of you guys would like to make before Zoom kicks?
This was great. I just hope that if folks are interested in volunteering, because that's what we're looking for presently, or if a person needs a peer contact, they can call the Medical Society, the Suffolk County Medical Society, which the number's on the website. And I expect by Friday we'll have that telephone number for them.
Great. Audrey,
Yes.
any any words of wisdom from a smart guy like you?
Well, I think one of the things is just like even when you're walking around, when you see your peers and colleagues, just to spend an extra 2 minutes talking to them, say, "How are you?" And probably people will open up their problems because when we are so busy at work and walking around and we don't focus on who is standing next to you and how they're feeling, and sometimes just giving them like 2 extra seconds and say, "How are you feeling today? How's your day?" and you stop and listen to them, I think that's very, very crucial because everybody's talking about social distancing and physical distancing and everything. And I think like more so when you going to walking through the ICU, emergency room and everything, just spend extra 2 minutes and say, "How are you? How's your day going? What can I do for you? Is there anything I can help you with?" I think just a couple of minutes with your peers will help them a lot.
Great. I agree with that, and that was very, very well said. Thank you so much, guys. Um, so this has been a broadcast in association with the Suffolk County Medical Society. I'd like to thank Doctors Rothberg and Dr. Nath for agreeing to be on the broadcast with us. If you want to speak with us, please contact us through any of ways possible, which is Twitter, email, Facebook, contact the Medical Society. And I really appreciate whoever was listening to the society. Please reach out to us.
Have a good night. We'll see you guys next time.
Guys, that was